bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Tanning beds, we're giving you the dark and light side of it. Hello again, and thanks for joining us. I'm Carla Shoa-Lee, and you're watching Comcast Newsmakers. Joining me today is Dr. Harriet Commente. She's a member of the American Academy of Dermatology, and today we're talking about the best and worst forms of tanning. Thanks for joining us today, Doctor. Nice to see you.
Nice to see you, too, and thanks for asking me.
I think you were in before, and we were talking about skincare dangers.
In the wintertime.
Yes, and I think that tanning beds is kind of like fits in that category because a lot of people think that this is a great form of tanning.
Yes, it's marketed as being very safe, safer than natural sun, but actually tanning bed rays are very dangerous. They cause damage to your eyes, cosmetic damage such as wrinkles and brown spots. They depress your immune system, but most seriously they can cause a dangerous skin cancer called melanoma.
Okay. Well, explain to people who are not familiar with tanning beds. I don't think I did to be...
you have your own natural
Yeah,
skin.
that's right. So a tanning bed, what is it? What does it do for the skin?
Okay. A tanning bed are longer wavelengths of light called UVA wavelength. They do not cause burns, but they do more damage than the UVB or the burning rays of the sun. So people don't feel the burn. They're getting a tan, but in the future we'll see more signs of skin cancer.
Okay, so you talk about it not even being healthy.
It's absolutely unhealthy. The safest type of a tan is an airbrush tan or customized tan, but tanning beds are such a danger that I think soon in the near future we'll be seeing warning signs on tanning beds that this may cause skin cancer in the future, such as we see on cigarette warning boxes.
Okay, so we do have a graphic, as you always bring, someone who has this custom airbrush tanning done to them, and she's very, very happy on the right, so obviously she's done this. So explain to us what has happened here.
She has an airbrush tan. On the picture on the left, it was before her tan. It's an airbrush that contains a bronzer, so you walk out looking immediately tan, which develops over the next 24 hours. It's not orange, it doesn't streak, it looks totally natural.
Mm-hmm.
As a matter of fact, one of my patients went to Florida and said that she was equally as tan as her sister lays on the beach at least twice a week.
Really?
Yes.
I may have missed it. How long of a time did she spend doing this? Airbrush tan?
She spent one time. She came in once to get an airbrush tan, left for Florida the next day, and all of her friends and sisters said that her tan was comparable to her sister's tan. Lying on the beach and as natural looking.
Really? Mm-hmm. So versus a tanning bed, how long do you usually spend within a tanning bed? I hear that you can't spend a long time.
No, it's minutes.
Okay.
But even in those minutes, you get a lot of sun damage. Actually, there's been studies that show that under the age of 35, if you even use tanning beds occasionally, you triple your risk of melanoma.
And you said that you had some patients actually that were in their teens that did a tanning bed, and then later on, what were the effects of that?
Well, the teenagers who like to get tans prior to proms or special occasions actually have skin damage in the 20s that require surgical excisions to remove. So it's very, very dangerous.
Well, tell us, what does vitamin D and the sun have to do with our skin? Should we be sitting outside getting vitamin D exposure?
Actually, that's an excellent question, Carla, because it's one I get asked all the time by my patients. Vitamin D is extremely important. What's important is to get the vitamin D from food and food supplements. It is not necessary to get it from sun exposure. So the best way to get your vitamin D is from food, not sun exposure.
Has it changed? Because I know when you think about the ancestors out there picking cotton, they were out in the sun all day.
Well, actually, they were, and you know that from years ago, wealthy women wore bonnets or hats to protect themselves from the sun. But people who were not as well off, who picked cotton, generally were out in the sun all the time. They showed much more significant sun damage.
All right, so we need some sunscreen
Absolutely.
being out there. Thanks so much for joining us today, Doctor.
Thank you very much.
All right, this hour's newsmaker has been Dr. Harriet Commente. She's a member of the American Academy of Dermatology. I'm Carla Shoa-Lee for Comcast Newsmakers, an exclusive Comcast production.